Please raise your hand if you ever had a fever before, an allergic reaction, or even a fractured bone. Almost everyone raised their hands. Now, I'm assuming that most of you guys just hopped in the car, went for a quick 10 or 15-minute drive to your nearest walking clinic or your nearest hospital, and got your treatment maybe in the span of an hour or so at a walking clinic, a few more hours at a hospital. But what if that wasn't the case? What if that nearest clinic wasn't just 15 minutes away? A few hours away? A full day away? No, I'm actually talking about way longer than that. I'm talking about a 3-day journey just to get to that clinic. Now, this might seem unrealistic for us to think about it this way, living here in Canada. But that's actually the reality for many people living in remote areas around the world. And one of the regions that contains a lot of remote areas is Madagascar. In Madagascar, a very high amount of people live in remote areas with rugged terrain and underdeveloped infrastructure, where accessing healthcare isn't just a challenge, to say the least about it. Where accessing healthcare is a matter of life or death. Now, by a large amount of people, how many am I talking about? Am I talking about 10% of the population? 20% of the population? That's 1/5, by the way. 20% is 6 million people. I'm talking about triple that. I'm talking about 60% of the population living in remote areas with no access to healthcare. More people having no access to healthcare than those who do. Now, someone might ask, okay, what if people in Madagascar have generally healthier lifestyles? Maybe they don't need as prompt access to healthcare as we might do here in Canada. But unfortunately, that's not the case. Because if you compare life expectancies between Canada and Madagascar, you see that the life expectancy in Canada is about 82 years. And in Madagascar, it turns out to be over 20 years shorter, at only 63 years. Now, this is not just a statistic that I'm sharing with you in the middle of my presentation to keep in the back of your mind. This is not a fun fact, if we could even call it so. This is a big global challenge. It's over 20 years shorter. And every challenge, just like this one, presents an opportunity for the leaders of this community to innovate and find solutions for. Before I continue, let me share with you this story. There was a story of a man who lived a long time ago in India, where his wife became severely ill. The only way for them to get to their nearest healthcare facility is that they had to walk all the way around a mountain, about a 70-kilometer trip. Now, unfortunately, like most of you probably guessed, his wife didn't make it through that trip. So what that person did for the next 22 years of his life is that he started carving a path through that mountain so no one else ever in his village has to endure that struggle and hardship that they went through. Once I read about that story, I was like, that's perfect. That's what we're doing in Madagascar. From today on, all we're doing is that we're going to start building roads, we're going to start carving roads whenever we have obstacles, or just start building roads. It can't be that complicated to build roads, right? I mean, but of course, that's not very realistic. That's not very feasible. So then the question arises, if we can't use traditional solutions to solve such a problem, if we can't just simply build roads, how could we use some of the existing resources we have and what's actually available to us to solve such medical care issue in remote regions? Recently, there was a case of a child who was suffering from malaria in a remote area in Madagascar. If you're unaware of malaria, it could be a life-threatening disease if not treated within 1 or 2 days. What the families would have done in the past is that they would have created those improvised stretchers like shown here on the right and carried that child through that exhausting and risky 3-day journey to get them to the nearest healthcare facility. But recently, this didn't have to happen. And the child was actually delivered their medicines in under a few hours. You might be asking how. It can't be through land, because if it's through land, then we had to build roads. Can it be through air? But then you had to use airplanes, helicopters. Where are you going to land them? How are you going to get the fuel for every single delivery? Also, might not be very feasible. But it was actually through air. It was through medical delivery drones, which are equipped to handle those sensitive medical supplies, ensuring the fast delivery times and the cold temperatures. The thing is, delivery drones are nothing that's exceptionally new. They have been used by for-profits like Walmart delivering packages in Texas in a few hours instead of a few business days, and even by DoorDash in Australia to deliver food packages, which don't even take that long usually. They take like an hour just to cut down a few minutes. But the question arises, do you think when we have such technology, should we just limit it to for-profits? Should we just limit it to making money? Or should we extend it to problems that are far more meaningful and problems that could have a much higher meaningful impact? But the impact of medical drones isn't just limited to those fast deliveries we're talking about. It extends far beyond that. When you make those life-saving deliveries, those children get to grow up healthier, they get to go to school, have an education, and contribute meaningfully to their communities. The healthcare workers in those areas report increased morale, knowing that they can rely on timely supplies and knowing that they can provide adequate and good healthcare to their patients. And such solution isn't just limited to one region like Madagascar. It extends far beyond that to nearby regions like Ghana, reducing vaccine stockouts, or in Rwanda, reducing also medical delivery times according to the Lancet Global Health by 60%, or even in high-income nations where they're being tested right now here in Canada for organ transport and for emergency medical deliveries. Which shows us how one solution could adapt to many different situations and many different scenarios. But all this started from a question. It started by someone asking if we were able to solve such a medical care issue using the tools we have available to us. If we're able to find unique ways to solve various problems using not using conventional or traditional solutions, rather using more creative ways. And this type of thinking isn't just limited to medical drones. It extends to far other solutions. So for example, vertical farming, reducing the space it takes to farm in urbanized cities, AI glasses using existing AI models to help those who are visually impaired, or even water towers using just a plastic mesh to collect water without electricity whatsoever. And some other simpler solutions like those neighborhood libraries where you give a book and get a book in return, some solutions that are more applicable to the younger youths, or a skill matching board, you teach a skill maybe at a club in your school and learn a skill in return, or even those water filtration systems we learned about in grade 10 science. The story of medical drones isn't just about technological advancement. It's about a kid who survived malaria, healthcare workers who no longer have to feel burdened by rationing supplies, and it's about leaders, just like us, thinking about ways to innovate and find solutions. And this continues with you. So what I'm asking you to do is I'm asking you to think of a single problem, just one problem you've been wanting to solve for a while. It could be in your community, it could be in your city, or even elsewhere across the world. Think about underused resources around you. So today we covered drones. It could be 3D printers. It could be even your phone or even an underused space at your house. And I want you to take a single step this week to actually try and solve this problem. And if you're up for it, what you could do is that you could text a close friend to yours and tell them my what if idea is, and I'm starting it this week to hold you accountable and actually make progress towards it. Because change doesn't come from waiting. It comes from leaders looking at the resources around them and taking that first step. Jazakumullah khair.